Hi, it's Dr. Hizon here to talk about the medical informatics for a patient with diabetes mellitus. I'm with Virtual Medical Informatics and want to help you to document better to help patient care. So as a disclaimer, please refer to your particular doctor for details on what documentation they would require. This is a general course not intended to be medical treatment, and your particular situation might vary. So in the chief complaint, the typical statement might be here for evaluation of diabetes mellitus for how many years, weeks, months. So that's a typical chief complaint. In the history of the present illness, a typical template might say that the patient is a so-and-so years old male or female with a history of, and then you put down their previous medical problems. Presents for diabetes. The diabetes is type 1 or type 2. Remember, type 1 is where they don't make insulin. Type 2 is where they make too much insulin. By far the most common diabetic is type 2 diabetic. How long have they had the diabetes? What is their blood glucose level in the morning? And then the other questions are, how often do they monitor? Do they do episodic sort of finger sticks, or do they have a constant glucose monitor? What's their current diabetes therapy? Is it pills? Is it injections? Is it insulin? And then what is their daily estimation on carbohydrate intake? And are they consistent with their carbohydrates they take in? And then, you can ask questions like, what do you typically eat? And when do you typically eat? How many calories do you eat? Sometimes the patients know this, sometimes they don't. And then in terms of physical findings, you want to ask, do they have any change in the sensation of their feet? Diabetics is the number one cause of non-traumatic amputation because they lose the feeling. They get neuropathy, they get neuropathy of their feet. And then, do they have foot ulcers? Do they ever get low blood sugars, hypoglycemic events? Are they on a blood pressure medicine to help their kidneys called an ACE inhibitor? Because they have a high rate of heart disease, are they on a cholesterol statin type medicine like Lipitor or Pravachol? And then what medications are they taking? What have they tried? What have they failed? What's their last hemoglobin A1C, which is a glycosylated hemoglobin that lets us know how their blood sugar's been over the last 3 months. And then for their kidney function, have they checked their microalbumin urine? And kidney disease is the big problem with diabetics. The number one cause of dialysis is diabetes. Have they seen an endocrinologist? Have they seen a cardiologist? And when's their last eye exam? Number one cause of blindness worldwide is diabetes. And then how about foot specialists? And then in terms of the past medical family social history, I typically ask about tobacco use, what's their exercise, nutrition, and sleep. Other than that, you look at their constitutional symptoms. Have they gained or lost weight since the last visit? And then objective findings. Do they have anything, especially their monofilament test? And then in the medical decision making, this is a typical thing we would say is that the patient has diabetes, so is encouraged to obtain tight control and to treat to target with diet, medications, with frequent glucose checks. Provided with educational materials on nutrition and the importance of nutrition, food hygiene reviewed, and then hypoglycemic events are precautions were given. These are the various types of ICD-10 codes that could be used. Type 2 diabetes without complications is E11.9, and you can read through the different ones. Type 1 is E10.9, and then diabetes with complications is E11.8. Type 1 diabetic mellitus with unspecified complications E10.8. And then if they have diabetes of pregnancy or gestation, it would be an O code, O24.919. And then you can have diabetic kidney complications in a type 2 diabetic, that's E11.29. If you had skin ulcers, it would be E11.622. And with a type 2 diabetic with retinopathy or eye problems, then you'd have E11.319. So the coding for diabetes gets quite intensive and specific. And then in terms of a typical plan is we'd improve their nutrition choices, encourage them to obtain their ideal body weight, There'd be different medications. Typical start-offs would be metformin and glyburide. There's quite a few medications that you as a medical informatics specialist will need to learn. There's different kinds of insulin. And then there's blood testing, both fasting blood sugar, either episodic or constant glucose monitoring, as well as the hemoglobin A1C that they all check typically every 3 months. They need once a year dilated retinal exams, monofilament testing usually at each visit, and then referral to multiple specialists is not unreasonable: cardiology, endocrinology, nephrology, and or ophthalmology. And the monofilament test is something where we use a small, almost like fishing wire, to see if they can feel. Typically a minimum of 4 spots would be looked at, and this would be how we do it. We just press it and see if they can feel it with their eyes closed. This is what the eye exam looks like. Normal is on the left, and diabetics have all of this exudate from the damage due to the diabetes. And then hemoglobin A1C is where the red blood cell gets glycosylated, or the blood sugar goes around that, and it can let us know how they've done the diabetes over the last 3 months. And then finally microalbumin urine testing to see if their kidneys are continuing to work. So in summary, and in pearls and pitfalls, you need to get the history correct as to when they were first diagnosed with diabetes mellitus. What type of diabetes do they have, 1 versus 2? You need to get all the medication and the dosage correct, and then you need to get the quality measures correct, because we as doctors get graded on how well we take care of our diabetics, and they need to document in the right part of the chart their annual dilated retinal exam, monofilament sensation testing, hemoglobin A1C testing every 3 months, and a urine testing for microalbumin. So takeaway points is diabetes mellitus has 2 types. Type 1 does not make insulin, so requires insulin injections. Type 2 is actually hyperinsulinemia or insulin resistance, and over 90% of diabetics worldwide are type 2 diabetes. And this is usually treated with diet, medications, exercise, and frequent monitoring. Remember, diabetes is the #1 cause of blindness, renal disease, and non-traumatic foot amputations, and diabetics have a high rate of heart attacks and cancer. These patients require attention to fasting blood sugar, hemoglobin A1C, microalbumin urine testing, eye exam, feet, and usually that is tested with a monofilament testing. Again, we thank you for your help in documenting patient care, because while doctors save lives, medical informatics specialists save us doctors. Thank you.